Final bill on the agenda today is House File 439 from Representative Xiong. Unfortunately, Representative Xiong is not able to join us today, so Representative Hassan is going to present the bill on his behalf. I will move that House File 439 be laid over for possible inclusion in the omnibus bill. Representative Hassan, welcome to the committee, and please proceed.
Good morning, Mr. Chair and members. I'm sure you were expecting Rep. Xiong for this presentation, but as you can see, I'm not him. I'll tell you that Rep. Xiong regrets that he couldn't be here today as he's engaged in a family emergency. I may not do justice presenting this bill today as it would be lacking his spirit and passion. However, I promise to do my best to give you an overview, and thank God there are others on the Zoom call who would give you more details. Throughout our history, we have left out groups of people without rulemaking, whether it's intentional or unintentional. The disability community is one of those groups we have left behind, as their voices are normally not at the table to fully advocate for their needs and voice their concerns. House File 439 intends to fix some of that and be sure that we eliminate subminimum wage. House File 439 creates a task force to look at the issue of sheltered workshops in Minnesota that employ workers with disabilities and pay less than minimum wage. More than that, looking at the sheltered workshops, the task force would be charged with developing and implementing a plan to completely eliminate workplaces that pay subminimum wage. Under the bill, the task force would be comprised of at least 16 members. And I'm not going to go down the list. I think this is listed on the bill. Among other things that the task force must do, they must develop and implement a plan to phase out subminimum wage by August 1st, 2025, identify the barriers and the benefits of phasing out sheltered workshops with subminimum wage, identify initiatives to support employment opportunities for people with disabilities, and make recommendations for resources and support for people with disabilities, including training. Perhaps the most significant part of this bill is the repeal of the statutory provision and the DALI administrative rules that authorize certain employees to pay less than minimum wage to disabled workers. With that, Mr. Chair, I believe I have a couple testifiers and we will stand for questions.
Thank you, Representative Hassan. First testifier is Noah McCourt. Mr. McCourt, please identify yourself for the record and proceed. Mr. McCourt, are you there? Well, we're waiting for Mr. McCourt. We'll move on.
Mr. Chair, I was. Yes. He is. Here you go. Here you go.
Yes, Mr. Chair.
Mr. McCourt, please identify yourself and proceed.
Thank you, sir. Whoops.
Mr. McCourt?
Sorry, I'm sorry, Mr. Chair, having technical difficulties. Mr. Chair, my name is Noah McCourt. I'm one of the co-chairmen of the 4 Cents an Hour Coalition, and 100% disability-led coalition that's committed to the phase out of the subminimum wage and fair and equitable employment opportunities for Minnesotans with disabilities. While I appreciate, the accolades of many of my colleagues on this issue, I think it's important to note that the conversation here didn't start with us or with me. It started with national advocacy organizations calling for and recommending that the Department of Labor impose a moratorium on the issuance of any new 14C certificates and enforce existing laws that were being violated. It's undeniable that this was designed as a first step towards the total elimination of 14C. Some people will testify before this body today about the importance of maintaining the choice or the option to work for subminimum wages. The belief that someone would choose to make less money for their work is in and of itself an example of how certificate holders view people with disabilities. They don't think the Minnesotans with disabilities are whole people capable of making even the most basic decisions beneficial to themselves And as you examine this issue, I urge you not to lose sight of the ultimate goals here, and that is the advancement of civil rights and employment protections for Minnesotans with disabilities. The ADA became the law of the land to ensure the equality of opportunity, full participation, independent living, and economic self-sufficiency. Each of these policy goals is completely compromised by the practice of continuing to pay people under minimum wage. It deserves to be acknowledged that the concept of 14C originated in the 1930s when nobody had any constitutionally protected civil rights, including people with disabilities. Anything done for people with disabilities in the 1930s, like affording them the opportunity to earn pennies an hour, is simply charity because the lack of belief in people with disabilities at that time that has continued into today. However, today in 2020, and in our society, people with disabilities have come to expect far more out of their lives than was historically allowed. We have different words for opportunity to work for pennies an hour, words like discrimination and exploitation. I could go into the legal protections here, but for the sake of time, I'd rather note the legal protections here that do not exist.
Mr. McCourt, we seem to have lost you.
To understand what protections are lacking, it's important to think deeper than the doublespeak and the narrative perpetuated by many of these providers, many of whom you'll hear from shortly. On one hand, providers will refer to people with disabilities they serve as workers. And well, on the other hand,
Mr. McCourt, we're having, we can't hear most of your testimony. Can you please figure out your connection or submit it in writing?
Yeah, I'll submit it in writing, Mr. Chair. I apologize.
That's okay. It's a brave new world of Zoom. We understand we all have technical difficulties. Okay?
All right, thank you.
Thank you, Mr. McCourt. Next up is James S. Clapper. Mr. Clapper, please identify yourself for the record and proceed.
Chairman Eklund and members of the committee, my name is Jim Clapper. I'm a parent of a young man with intellectual and developmental disabilities who receives MA waivered support for both residential and employment services. Thank you for taking my testimony. My son Bob, who's in my background behind me in his job at Kowalski's, has been happily employed since 2008 in a number of positions, all made possible under the provisions of 14C of the Fair Labor and Standards Act. He started his employment in a center-based employment program doing light assembly and packaging work in a day training and rehabilitation program near our home. His wages at that time were about $2.35 per hour, which were commensurate with his level of productivity. This is about 35% of what the minimum wage was at that time. Today, he works on a mobile work crew in the community at Kowalski's and earns about $7.88 per hour, which is about 85% of the current applicable minimum wage. Again, commensurate with his level of productivity. He has almost tripled his productivity in this time and moved from a center-based employment setting to a community-based employment setting. And we're very proud of his progress. Bob is very proud of himself too, even though he does not have a firm grasp of money. His income helps support his food and living expenses and does reduce his support costs from other state and federal entitlements. The 14C provisions provided Bob with choices and opportunities to start his employment and then steadily develop his skills and work ethic over the last 13 years. If the restrictions of HF439 had been in place in 2008, he would have only life enrichment activities at his day training and rehabilitation program. In addition, customers that contract out for this work would have moved away from disability employment programs in order to compete. Bob's story represents about 7,000 individuals with intellectual and developmental disabilities in Minnesota who are thriving under the provisions of 14C and will lose their employment if HF 439 passes in its current form. On behalf of my son, Bob, I ask you to reject HF 439. Not only will this bill reduce employment opportunities, it will establish another expensive and bureaucratic process which will be redundant with what already exists. I implore you to avoid fixing something that is not broken. Commensurate wages with 14C provisions work. Thank you very much.
Thank you, Mr. Clapper. Next up is Julie St. Marie Bingham and Marissa Bingham. Please identify yourselves for the record and proceed. Ms. Bingham, are you there?
Mr. Chair, I don't believe they've joined the meeting yet. I'll keep an eye out though.
All right, thank you, Mr. Reese. Next up are Don and Laura, and I'll get this name wrong, Kabokovich. Please identify yourself for the record and proceed.
Okay, I am Dawn Kabakovich, and this is my daughter, Laura Kabakovich. I am a retired special education teacher who lives in rural northern Minnesota. I'm here today to urge you to oppose House File 439. In contrast to what Mr. McCourt shared with you, it is because I value my daughter as a whole person, because without 14C provisions, she would not be able to work at all. The severity of her disabilities, like thousands of other people in Minnesota, have behavior disorders, mental health disorders, autism, just a whole slew of abilities and disabilities that affect their ability to be in a mainstream competitive employment setting. It does not work for all people. But like many people, Laura has mixed abilities, and I'm going to let her start by sharing her story, why she believes we need a full range of employment options, from completely supported work settings that provide commensurate wages that are ability-based, which is what 14C does. And I also urge you to understand the law that 14C, these clients have to be tested twice a year for their rate of ability. And as Mr. Clapper testified, his son's growth over the years has increased, and with higher ability, higher pay. So if a person's already working at an average ability level, they should be earning minimum wage by law, by 14C law. It is actually an old law, but just like our Constitution, it's a law that has stood the test of time. So Laura, why don't you go ahead and share with them a little bit about yourself and tell them why you need to have a supported work setting.
Welcome to the committee, Laura.
My name is Laura Kavakovich, and I am 29 years old, and I can't and don't want to work in the competitive community because I have vision problems and high anxiety disorders, which causes me to get anxious and upset easily. And if I am not in a safe work center, people might bully me because of my disabilities, and job supervisors who don't understand my disabilities would not know what to do if I become anxious or upset easily. And that's why I need a supported work center. I work at the Howard County DAC in Park Rapids in the Barely Used Thrift Store, where I do all kinds of different jobs, such as pricing items, filing office papers, and making stripping balls for the rug weavers. And I have a lot of job supervisors there, like Linda Kay and Nancy and Richard, who understand my disabilities, so they would know what to do if I become upset or anxious. I love my jobs because a lot of my coworkers have disabilities just like I do, and they have become my friends. If I could no longer work at the DAC, I'd be bored at home and separated from my friends. So you shouldn't take away any of my choices.
Okay, and that's another factor in this whole 14C argument is that many of the people who are opposed to it don't understand that this is not a mandate. This is a choice. People want to be at supported work centers. I prefer to call them that because sheltered workshops have developed kind of this negative connotation like a sweatshop or something, but they're not like that. They're providing very creative, these people who choose to work there as supervisors want to be there. They like working with people with handicaps and they are creative. They're creating jobs all the time that help people become productive at their ability with their interest. The other thing is that as Representative Hoden shared with you, she wants to set up a task force after the fact. To me, it would make sense to actually get the data and the research of the impacts of a law before you remove a law. This law is working for people. And in Minnesota, there's like almost 10,000 people that are benefiting from the 14C provision. And by federal law, the Department of Employment and Economic Development has to annually interview everybody. In 2019, 9,900 people were interviewed by the state of Minnesota. 83% of them indicated satisfaction with their current working situation. They're not interested in competitive employment. That means we would displace nearly 10,000 Minnesotans if this were eliminated, if this provision was eliminated. We're not ready to do that. What are you going to do with all these people? And we're talking about people that cannot work in the competitive employment. And there's lots of them. And they're very happy where they are. Most people, and the laws have created transition from high school. We've got people that are least restrictive environment, which means that they have to be provided all the way up to their main ability. They don't suddenly lose their handicap when they graduate from high school, but they still have to be transitioned by being tested to see if they can work in the competitive environment. And many of them can't. They've been unsuccessful. They've already tried, and they found that their productivity is not high enough to measure up to what most employers would expect, or their needs. You know, if they have a tantrum in the middle of a workplace, it just doesn't work. Additionally, last year, the 2020 Civil Rights Commission did a public comment period. 98% of almost 10,000, there were 10,000 submissions, which is like the highest they've seen in years, were in favor of retaining 14C. This is at the national level now, and we're talking thousands and thousands of people that will be affected by this. I'm a court-appointed legal guardian, as is Mr. Clapper, and we're entrusted, just like parents are, to look after our loved ones who have special needs. We have to come to terms ourselves with the limitations of our loved ones. And for anyone to tell me as a parent who's lived with this person that I value her less as a human being, to see every service that's available to her shut down with one sweeping law like this, every work center will be shut down. They will not be able to have the opportunity to work. And just because somebody qualifies for SSI does not mean that they aren't capable of work or that they aren't wanting to work. Laura has the choice every day to either exercise, do games, do crafts and activities. They have all these day activities there, but she also has the choice to work. And what do you choose to do?
I usually prefer to work because working's my choice.
Yeah, and working is something that gives people self-esteem. It helps them have a feeling of belonging. And truth be told, it is her civil right to pick and choose who she wants to be among. And if her friends also have disabilities, to say that, no, you're better off in the community as a minority. And truly, this group of people, disabled people, are the only ones that are being singled out systematically to say that you must be a minority among non-disabled people. This should be a choice. This is a civil right, a constitutional civil right to choose who you want to be among. And she chooses to be among her friends. And she loves to have supervisors that joke with her and understand her disabilities and celebrate them. Not all work supervisors can do that.
Ms. Colbert, We're running very short on time, so if you could please wrap up, because I have 3 more testifiers.
I will
and
wrap it up.
We have
Thank you.
members' questions.
The last point I want to make is that rural America, which is where we live, has limitations on jobs to begin with. And to expect that suddenly these jobs are going to pop up all across northern Minnesota and southern Minnesota that are tailored to the needs of handicapped people, not realistic at all. And to have some sort of work center where they have a community hub, we've got creative staff creating jobs for them that they are working at their own ability level, and they're being compensated fairly. This isn't about making a living a wage. It's about quality of life. So on behalf of my daughter and her friends and coworkers, I'm urging you to understand that denial of options to work at their own abilities in a least restrictive environment where they can meet their full potential is just as discriminating as denying somebody the opportunity to work in competitive employment. No one is denying the opportunity to work in competitive employment, but elimination of 14C denies her and people who have needs at her ability to work at all. It's all or none. That's what capitalism is. So thank you so much for your time, and I'm sorry I went over time.
Thank you, Ms. Kvokovich and Laura. Next up is Jim Sillery, and members, we have 10 minutes left, so please be brief so we can get this.
You judge.
Mr. Sillery, please identify yourself for the record. You're muted, Mr. Sillery.
Okay, thank you very much. First, I'd like to thank you, Mr. Chairman, and the members of the committee for taking my testimony and allowing me to share my perspectives on this issue. My name is Jim Sillery. I live in Eden Prairie, Minnesota. And my direct experience in this matter is personal. I'm the parent of a young adult on the autism spectrum. Where on the spectrum? Probably on the unfavorable side of middle of the road. And he's working at the Asplin Center in Plymouth, Minnesota. My personal perspective has also been broadened by a lot of things that I've done, including volunteer work with organizations like Opportunity Partners, Reach for Resources, and Special Olympics. In addition, I'm currently serving as a member of the DHS Technology First Advisory Task Force. The mission of that task force is to advise the commissioner on how to increase the use of technology by people with disabilities as prescribed by the Olmstead decision. My son Adam has been happily employed at the Asplin Center for over 8 years. And Asplin has been more than a place for Adam to work. In addition to its center-based employment program, Asplin provides adults with intellectual development disabilities with a broad range of programs to help develop life skills. It also serves as a community for Adam and for the other adults that go to Asplin. And friendships are made there and experiences are shared. And that's a key part of life for people with disabilities who don't have access to friendships and community like we do. All of this is made possible under the provisions of 14C of the Fair Labor Standards Act. I'd say during this period, I've seen Adam grow in confidence and self-esteem. He has remarkable development. His ability to interact with others has increased significantly. And as I think about it, maybe this isn't surprising. As I research the origins of Section 14C, I find that it was originally intended to provide opportunity and choice to people with a disability to have the option to work for competitive wages. And in many cases, adults come out of school, out of transition, and they aren't prepared to do that. A center-based program like the one at Aspen provides the opportunity for training and the life skills necessary to work competitively. And as Mr. Clapper testified, there's many success stories, his son included. But they come out better prepared to provide performance. But not all of these adults can succeed in a competitive environment. My son Adam, for example, would be very, very difficult for him to work in a competitive environment where he would be expected to have productivity at that level. So a center-based program gives them a choice to work in an environment where they feel safe, they can work as part of a community and have staff support. It's also cost-effective. I've lived in states where without the choice of a center-based program, these adults just sit at home and they create a financial and emotional burden on their families. The 14C provisions provides Adams and others with choices and opportunities to start employment and then steadily develop skills, self-confidence, and work ethics. If the restrictions of HF439 are no longer in place, these choices and opportunities simply cease to exist. Businesses that contract out this work, if their intention is to provide cheap sources of labor, can just send the work overseas where cheap labor is abundant. In fact, it's interesting to see that many of these organizations are doing this not because the labor is cheap, because they understand what the productivity underlying it is. They're doing it because of altruistic reasons. Adam's story represents a large community of individuals with intellectual and developmental disabilities who are thriving under the provisions of 14C because they cannot succeed in a competitive environment. And if HF 439 passes, they'll simply lose their employment. On behalf of my son, Adam, I ask you to reject HF 439. Not only will this bill reduce existing employment opportunities, it provides no new choices and opportunities to replace them. We're simply going to eliminate a program and have no solutions in place for the people that won't be able to be competitively employed. So I implore you to avoid fixing something that's not broken. Commensurate wages using the 14C provisions continue to serve the needs of our community. And thank you again for allowing me to testify.
Thank you, Ms. Sillery. And I've got to remind the next two testifiers, we have 5 minutes left in committee and we do have a member question. Christina Petrenko, Minnesota Legal Aid and Minnesota Disability Law Center. Ms. Petrenko, please identify yourself.
Thank you. Good morning, Chair Eklund and committee members. My name is Christina Petrenko. I'm an attorney at the Minnesota Disability Law Center, which is a statewide division of legal aid. We serve as the protection and advocacy system for people who have disabilities in Minnesota. Thank you, Representative Xiong and Representative Hassan, for your leadership on this important bill. We strongly support HF 439 and efforts to phase out subminimum wage in Minnesota. People who have disabilities can work in the community alongside people with and without disabilities earning minimum wage or higher. Wherever they choose to work, people who have disabilities deserve to be paid at least minimum wage for their work. Doing so is a human rights issue. Minnesota can phase out subminimum wage with good planning. Our office has researched this transition in other states. In several other states that have done it, people with disabilities experience significant advantages. They have earned higher wages, they're working in jobs and careers that match their interests, and they're forming relationships through work with coworkers and community members. Transitioning away from subminimum wage will take work and planning to ensure that people who have disabilities have the support they need to find and secure the jobs they choose, as well as opportunities to find meaningful non-work opportunities during the day. We will need to meet people's transportation needs and support service providers financially and with technical assistance to transform their employment services. Our day programming models will also need to offer integrated supports. Minnesota can meet the challenges of this transition. Many providers have already begun the shift, and we are grateful for our collaboration with more and others. HF 439 would establish a task force to develop a comprehensive plan before subminimum wage is phased out and would allow 4 years of thoughtful transition to ensure that Minnesota has the time and planning to ultimately end subminimum wage in a way that allows people who have disabilities across Minnesota to access work, support, and services they need. Thank you very much, Chair Eklund, for your time today, and Representative Xiong and Representative Hassan for your leadership on this bill. I hope you will support HF 439.
Thank you, Ms. Petrenko, for your testimony. Next up is Brittany Hernandez-Wilson. Ms. Hernandez-Wilson, please identify yourself for the record and proceed.
Good morning, and thank you, Chair and members of the committee, Representative Xiong and Hassan. As stated, my name is Brittany Hernandez-Wilson. My pronouns are she, her. I live in St. Paul, work full-time. I'm an active community member and proud disabled woman of color. When I was born, doctors told my mom that I was disabled. And when I was only a few days old, they prepared her to handle my condition by placing limits on my capacity for life. They set expectations for what I could and could not do, for who I would and would not become. Thank goodness she didn't listen, because they were wrong. I often wonder who I would be if she had listened. And as I grew up and made friends with other people with disabilities, I realized that that part of my story wasn't unique at all, because they too were given labels and diagnoses that attempted to frame who and what they could be. And that is part of how ableism works, through stereotypes and expectations, often perpetuated by society and even those closest to us, as you've heard today. Ableism can also be sustained through our laws. And when we have a law still in place 30 years after the ADA has passed, may I remind us, that allows those with intellectual and developmental disabilities to be paid less than the rest. It says something about their value and worth in our society too. It says they aren't valued enough to be worthy of bare minimum wages. And in many cases, it binds people with intellectual and developmental disabilities into a life of forced poverty and isolation. And that's why it's so important that I urge you to support House File 439 and the phase out of subminimum wages in Minnesota. If people with disabilities can't even be paid minimum wages, when will they ever be seen as equals in our society? This bill will give our state time to develop a strategy that ensures no one who relies on these services are left behind, to ensure that they have the supports that are needed. Disability is not a monolith, and people with intellectual and developmental disabilities must set and define their own limits instead of being told them. To be given supports that focus on their strengths and talents, to find employment that feels right for them, employment where they are paid competitive wages, given opportunities for growth and connection in an interabled workplace that is undoubtedly the future. I wish I had time to fully express how my presence has impacted the culture and community in my workplace, how coworkers start to notice when things aren't accessible, how their lens shifts and adjusts to be more diverse, equitable, and inclusive. Because individually customized and integrated employment goes beyond benefiting the person hired. It makes the entire workforce stronger too. Providing a seat at the table, a chance to redefine what's possible, and a future that is reclaimed on our own terms is the bare minimum. And the time to act on that future is now. Thank you.
Thank you, Ms. Hernandez-Wilson. Member questions, Representative Edelson.
Thank you, Chair. And I want to thank all the testifiers. It's been good to hear everybody's perspective. I understand that there's a lot of fear around this bill, and I could see why. I also know that states like, when I was looking this up and reading more about it, that Alaska, Maine, Maryland, Nevada, New Hampshire, and Vermont all have actually abolished the subminimum wage for people with disabilities. So it just, I guess, maybe legal aid or the Disability Law Center has more information on what has happened in those states. I do appreciate the approach of having a report come to the legislature by 2023 and having a working group on this. I just want to make sure, though, that people that do have those fears, because these are real fears, right? Families are not wrong because they're worried about what's working for their kids. I just want to make sure that they have a seat at that table, too, if this actually does pass, because we don't all have to agree on this, but what we do have to make sure is that there's opportunities for people, and those are people with all different abilities. So thank you so much.
Representative Hassan, you have a comment on that?
Thank you, Mr. Chair. I appreciate everyone's perspective in this, and I understand that when we talk about this issue and the people that are testifying today, some people are talking about their children, and some people are talking about their individual selves. And this is a tough issue, but we also have to think about this issue as a fairness issue. There are many reports that indicate that, people with disabilities being isolated, being very vulnerable, being taken advantage of, and then the fact that they get paid at minimum wage. Those are all facts, but it's also a fact that when there is change, that it's okay to, have the fear of not knowing what's going to happen. But I would highly encourage that family members and the disability, community, as well as the advocates, come together and have conversation around this issue so we can come up with a solution that works for everybody. But I truly believe eliminating the subminimum wage is the right thing to do, as well as keeping everyone's, concerns at the center and the heart of this issue.
Representative Detmer.
Thank you, Mr. Chair. And I'm not a supporter of this bill 439. I think I would like to thank Mr. Clapper and Ms. Kovalchevich and Sillery, Mr. Sillery, for coming in and testifying. I would also encourage any legislators to maybe go visit a center. I have a center in Forest Lake, Minnesota. And as soon as I was invited, I walked through the doors and I was pulled in all different directions by the people that were working there, these young people and elderly people with disabilities or special needs. And they wanted me to learn about the work that they were doing and how they were doing it and how they felt part of the community. I think this is a great program that we have going. And I just support those types of programs, and thank you to those testifiers that came and spoke today. Thank you so much.
Representative Bliss, you had your hand up. Have your questions been answered, or?
Yeah, thank you, Mr. Chair. They're fine. I don't need to ask them.
All right. Seeing no other member questions, Representative Hassan, you want to make final comments?
Yes, Mr. Chair. I want to thank everyone. And Representative Detmer, I have visited several centers and I have seen the work that goes on. And I still support eliminating the subminimum wage. I still support that we pay people a fair wage for the work that they're doing, and that we support our disabled community and folks, and that we see them as human beings, as individuals, and as contributing members and productive members of our society. And with that, I know the bill is going to be laid over and it has some work to do. I am sure Rep. Xiong will continue to work with the families as well as the advocates to make this bill better and much stronger. Thank you very much.
Thank you, Representative Hassan. I will renew my motion that House File 439 be laid over for possible inclusion in the omnibus bill. The bill is laid over.